Hello, my name is Alyssa and I'm with Noster Physical Therapy, and today I'll be starting a new series on hip flexor strengthening and training. Hip flexion is the action of raising your leg out in front of you, and it is created by four muscles. The first two work together and run along the same pathway. They are your psoas major and minor. They attach on the front side of those lumbar vertebrae and travel through the pelvis and attach down into that femur. You also have your iliacus, which sits on the inside of your hip bones on either side, and it runs into that same tendon as the psoas muscles. They oftentimes get placed together and are referred to as the iliopsoas. So if you ever hear that muscle name, it's actually the combination of those three muscles. You also have your rectus femoris, which is one of your quad muscles that travels down from the knee and attaches up into your pelvis. It doesn't travel as high as some of the others, but it can be a common instigator of hip pain and issues and tightness from that standpoint. A lot of times our hip flexors get a bad rap for causing a lot of anterior hip pain, low back pain, and oftentimes that's because they are short. They are not short because they are strong. They are actually usually short because they are weak. So when our muscle cannot actively hold us in a position, especially at a stretch position, it will actually get shorter. So that way it doesn't have to actively hold that position, but uses those passive forces of anything short of actually tearing that muscle, it will hold. So in order to improve kind of that hip flexor length and stability, we actually need to strengthen those. And so today I'm going to show you the first step in that activity. Depending on your mobility abilities, or if you have any injuries that prevent you from maybe lying down, I'm going to show both a sitting and a supine version, which is laying on your back. The supine version is one we tend to use a lot more, as it's more of a full range of motion. But if you're not able to lay on your back for any reason, the seated version also works as well. So I'm going to start with the seated version today. For this, in order to increase the range of motion that you are actually able to use with this position, I recommend like a higher chair, a higher couch, anything, or a bed. The edge of a bed maybe tends to work a little bit better. So here we're going to sit with that leg propped out in front of you. What we will do from this position, trying to stay nice and upright, you can kind of hold on to provide some support, but really trying to stay upright with the core, and we're just going to lift that leg up out in front of you. So nothing too strenuous, nothing too crazy. If that gets pretty easy, moving into that 15 to 20 rep range, you can add an ankle weight or anything like that to make it easier. So if you have a mobility issue that you can't lay down for any reason, this is a good place to start until you're able to do that. Next, we will move into a supine position, so laying on our back. So I'm going to show you on my left leg what we are trying to do. So we will start, your right leg will be bent up. This usually tends to be the most comfortable for the pelvis and provides a better position for us to start from and more stability of that hip. So what we're going to do, keeping that leg nice and straight, we're going to contract the quads here, trying to extend that knee, and we're going to lift up. I like to tell people to go to the height of their other knee if it's bent up. You can go a little bit further, but then you tend to get some tension along the hamstrings and the back of that leg. So here, just nice and easy, nice, slow, and controlled. One important thing is when you're coming back down, we don't want to just drop that leg. We want to make sure that we move at a nice, slow, controlled pace. If these get very easy, once you're getting to 30, 40, 50 repetitions, you can either add an ankle weight, like we have in the clinic, just put down low on your ankle, or you can also use a resistance band if that's something that you have instead. For that one, it's a little harder to do, but we will adjust the position of that other leg, so you'll want to extend it out a little bit further, but then you can just raise up with that resistance band. If you really want an increased challenge with this or with the ankle weight, try holding for a couple seconds at the top and then come back down. And then obviously starting at 10 to 15 reps as you can tolerate and progressing up into that higher rep range. As always, if there's any way that we can help you, feel free to reach out to the clinic or check us out at knobpt.com. Thank you.